This is an Evergreen Media Network studio production.
Good morning, everybody. I'm Dr. Brett Haake. I'm here with my wife, Dr. Felice Haake.
Good morning.
We are live here from one of my favorite places in the world, Vero Beach, Florida. And this is the Preventus podcast. Preventus means, in Latin, it means prevention. And we are both physicians. We're going to talk about who we are and where we come from. But the purpose of this podcast is we seek to understand disease processes, and we seek to, by understanding disease processes, we seek to translate the language of medicine and the language of disease into layman's terms, with the hope that the consumer of healthcare and the listener to this podcast can implement these things in an easy and an effective way in their daily life. And the other thing is that we hope that we can really stimulate conversation. So if there are things that you take away from this podcast, the hope is that you can go to your healthcare provider and really stimulate conversation and make you a more effective and precise consumer of your healthcare products. So really, this podcast can apply to anybody and everybody, age 18 to 110 years old. So the first thing we'd like to do is kind of talk about who we are and where we come from, what we've done in the past and what we're doing now. And so to start, I'd like to introduce to everybody my best friend, my favorite person in the world, my favorite physician in the world, and she also happens to be my wife, and that's Dr. Felice Haake. So,
Aw, thank you, tear.
So tell us. First thing I think we need to is Felice, talk about who we are, where we come from, and our training, our background. Sure. In conventional medicine and why we're doing what we're doing right now.
Sure. So just to go back a little bit, for me, I was born in North Miami Beach, Florida, so I'm a Floridian, and really didn't set out to be a doctor. I kind of was on this kind of wandering path, went to University of Florida, and was a psych major. And the way I got into medicine was I kind of got locked into this this science class, psychology class, but it was very science-based. And I excelled at it. And I watched everyone else in the class was struggling, and I was excelling. And I was amazed by that because that was not typical for me. I was not always a good student. And it really piqued my interest in science, and I kind of thought, well, geez, I have a knack for this. And so I sought off on the path to be a nurse. And then through a bunch of different convoluted things that I won't bore you with, I ended up deciding to go to medical school. And we went to medical school, both Brett and I, down in South Florida, Nova Southeastern, and we are osteopathic physicians. And that is where I started and went through medical school. And in medical school, they let you kind of take different paths so you can see what area of medicine you might want to do. I went in thinking I was going to be an OB-GYN. I don't know where I got that idea. And I left deciding I was going to do family practice, which a lot of people call cradle to grave medicine. And through that, I started to find an interest. Once I went into residency, I found an interest in bariatric medicine, which is weight loss medicine. And I pursued a board certification in both family practice and bariatric medicine. And then, of course, through bariatric medicine, I really became interested in prevention and functional medicine, because through that pathway, what I saw was, wow, if I could help people lose weight, that was sort of a side effect. The patient came to you because they wanted to lose weight, but what they didn't realize was they were going to reverse a lot of the potential for chronic illnesses like heart disease and strokes, even Alzheimer's disease, cancers. And when I started seeing people kind of take hold of their health by losing weight, I realized there's something more than just the weight loss. And that's when I kind of started to focus on functional medicine, preventive medicine. There's lots of names that are kind of tags that people place on us, like anti-aging doctors, longevity doctors. You can call us anything you want, but that's what our focus is.
I love it. before we get too much into what we do right now and how we kind of came to the position that we're in right now, I think the audience would find it interesting. Two things. I find this interesting. Felice went to University of Florida not knowing that she wanted to do the pre-med route. So when she decided to want to become a physician, she went and had to retake a lot of the pre-med classes. And so she went to NYU, and she lived in Manhattan, and she was there during 9/11. So just as a side note, it's kind of an interesting experience. And then the other thing I just want to point out is I think a lot of people that are listening to this podcast who are in science or who are in the healthcare field have taken organic chemistry. And I always like to point out to everybody that when my wife was taking organic chemistry at NYU, she got 100% for the class. Not just 100% on a test, but 100% for the class. So I always find that to be a really interesting statistic. I've never known anybody that got 100% in organic chemistry. So I find, so very interesting. But talk about your experience in New York and being at NYU and 9/11, and then kind of leading into how we met.
Yeah.
And I mean,
I kind of lasered over how I got to be a physician, but yeah, that was a big part. I went through, University of Florida, graduated with a psych degree, and then was like, well, geez, I want to be a doctor now. I haven't taken all the courses, so I had to go back, and it's called post-baccalaureate pre-medical program. And there were a bunch of them to apply to, and NYU really, really appealed to me because it was in New York City. And, like Kirk Vonnegut said, live in New York City once, everyone should do that. And so I convinced my father that was the only place I could do post-bac pre-med program, even though I could have probably gone to FAU or different places locally. So went up to New York and had a phenomenal experience there, 2.5 years at NYU, and took all the, pre-medical courses and criteria. And then, happened to be there during 9/11, happened to be standing on the street because I lived in the financial district, and happened to see the first plane hit. So that was quite an experience, that's for sure. And ironically, if you fast forward to when I went to medical school and got in, which is a whole long story on it in and of itself, and met my future husband, that's kind of what we bonded over. We were sitting at a table in a very unhealthy fast food restaurant with a bunch of other Quiznos. If anybody knows Quiznos,
yeah, it's exactly the opposite of what we're advocating right now. But we were giving ourselves insulin resistance. Of course, when you're 26, it doesn't matter. But that's kind of where we bonded. Exactly.
But I will say it was a whole table of medical students, probably 8 or 10 of us, and we were talking about where we all were on 9/11, going around the table. I didn't bring up the subject, and I kind of got to me, and I said I was there. I was on the street. I saw the planes hit, and the only person who seemed interested in that fact was Brett. He just was like, wait, whoa, what? So that's really, honest to God, how we kind of bonded and started studying together and really developed, I feel like, a friendship first.
Absolutely. Absolutely. It was funny. When I first started medical school, I was a little nervous, and like a lot of students had some anxiety and maybe some self-doubt and those kinds of things. And I remember my Uncle Ron, who's a physician. I come from a family of physicians, but I remember my Uncle Ron, who is a physician, and we were talking on the phone, and he says, man, he goes, really have fun. I look back at those days, and I had a lot of fun. And at the time, it was like my first couple weeks in school, and I felt like I was drinking from a fire hose, trying to understand and get the information being presented. And I thought he was crazy. But looking back, it was a phenomenal time. Fort Lauderdale is a great place to go to medical school. It's a lot of fun. The nickname for our class was the UN, because literally I think every habitable continent was represented in our class. True. And it was just a lot of fun. But getting to it, so I'm a cardiac anesthesiologist by convention. And our backgrounds, Felice and I's backgrounds, are actually really, really different. It's actually kind of interesting how we met. I come from a military family. My grandfather was an infantry Marine in the South Pacific, and he was with the 2nd Marine Battalion, which at that point in time was the 9th Marine Regiment, so 2-9, and that fell under the 3rd Marine Division. and saw heavy combat. And so I always had a strong desire to want to join the military. And in addition to that, my father is a physician and my uncle is a physician. And so I wanted to go in and become a physician. But before that, I was a college baseball player and then played a few years in the very low levels of the minor leagues. If you look me up on Baseball Reference, please don't do that, because you're not going to want to be my buddy after that. The stats are just not very impressive at all, and I have a lot of funny stories about that. But it was a great time. I ended up going back, taking a few classes, and ended up doing good enough on the medical college admissions test to get into medical school. And then, of course, the next problem was to try to figure out how to pay for school. And for me, it was no question I was going to join the military. And so I applied for what's called the Health Profession Scholarship Program with the Navy. And what that means is if you get that scholarship, the Navy will pay for your medical school. And then as soon as you go active duty, or as soon as you graduate from medical school, you go active duty. And so I've always been a lover of country. I've always wanted to join the military. And as a physician, I wanted to go with the Navy because I wanted to be with the Marines. And that's what I got the opportunity to do. So Felice and I met very quickly. We're pretty much inseparable. And we got married a couple years after we met. And so now we have 3 kids. We live here in Vero Beach. I went active duty. We married in 2006. I went active duty in 2007. I was 8 years active duty in the Navy. 2 of those years I spent deployed with the Marine Corps. 1 year, close to 1 year, was in a shock trauma platoon in Afghanistan in Helmand Province with what's called 1st Med Battalion in service of 1st Marine Battalion, 7th Marine Regiment, so 1-7 at a place called Camp Dwyer in Helmand Province. And then another year was spent with the Marines with 3rd Marine Logistics Group in Okinawa from 2008 into 2009. So out of those 8 years, I spent 2 of those years stationed with the Marine Corps, and then the majority of the 6 other years I spent stationed at the Naval Medical Center in Portsmouth, Virginia. And so I like to tell people I love to fish. I love to offshore fish now in Vero, but I spent 8 years in the Navy and really didn't get my sea legs until I moved to Vero Beach. So I was still getting seasick going offshore when we moved, and everybody asked me, weren't you 8 years active duty? And I'm like, yeah, but I never spent time on a ship. So
yeah. So
why is it that I'm interested in the same kind of medicine that Felice is interested in? And the answer is actually pretty simple. As a cardiac anesthesiologist, I've spent the majority of my career taking care of sick vascular patients, and I'm at the tip of the spear doing that. So I can see firsthand the way that what I'm doing to put people to sleep safely alters their physiology, and how dangerous it is when somebody has end-stage disease. So I have really an obsession with understanding vascular disease, understanding how to prevent vascular disease. And by extension, I have an obsession with lipidology, which is almost like a never-ending science. The more you learn about lipidology, the more you realize that you don't really know.
Can I interject?
Sure.
Just to make sure, everyone understands. So when you talk about vascular disease, you're sort of talking about arteries, and people think maybe, heart attacks and things like that, but it's everywhere. It's systemic.
Yeah. Thank you for clarifying. And what we're talking about really is a disease called atherosclerosis. You hear a lot about atherosclerosis. Atherosclerosis can manifest in any artery in your body, and when it manifests in the heart, we call that coronary artery disease, and sometimes that can present in what we call a heart attack, right?
Yeah.
And so I'm obsessed with trying to understand that, as Felice is. So by extension, when I say lipidology, that means the cholesterol panel that you look at with your physician when you go to the doctor. And then in addition to that, one of the things that we both, in addition to lipidology and cholesterol, we both have an obsession with is something called insulin resistance. You're going to hear us talk a lot about insulin resistance, and so that's one of the big things. So
yeah.
And before we and we're gonna really talk about a lot of things. We've got a lot of episodes coming up. We're gonna talk about insulin resistance. We'll do a deep dive into trying to understand cholesterol and trying to translate that. We're going to talk about cardiovascular risk mitigation, but we also want to bring people in that we consider to be experts in the field in terms of things like exercise. So form and functionality, people that really, really understand how to get people moving in the right direction, regardless of if they're a professional athlete or they're 70 years old and they've never worked out in their life. We have people that we really trust that we send, to begin an evidence-based exercise regimen. We're going to talk about nutritional supplements. That's a huge sort of Wild West environment, an unregulated environment. And we have people that we really trust that understand quality, that understand, how to direct the consumer to the product that they most, need. And so we're going to talk about that. We're going to talk about aesthetics. But we really want to kind of make it a podcast to where we can translate the language of medicine and get people talking, stimulate conversation with the hope that everybody can at least implement something from what we're talking about, make themselves, by preventing disease, make themselves more functional. And ultimately, the goal is to make it to you where you have a longer and healthier life, or increase your chances of doing that.
Yeah.
So,
and can I add to that, when people think of health, they often think of physical health. Physical well-being, but there's so many spokes to that wheel. There's emotional health and social health and psychological health and spiritual health. And so I really hope that this podcast kind of goes beyond just what we think of in terms of physical health, because it's all encompassing. I talk to my patients a lot about it. Currently, I do concierge medicine. We have a facility, and that's a big part. They're often kind of surprised when I first meet a new patient why I'm asking about their life, what they do for a living, how much stress they have. I get into all the kind of nooks and crannies of their life, and they're often surprised by that, because that does contribute to your health, your overall health. So yeah, you might think of this as a health podcast, but we may have some episodes that you'll think, well, how does this relate to health? And trust me, it does.
Absolutely. Like, we have, no problem, bringing on people that are mentors, people that are really close with us, pastors of churches, just people in the community that are out there doing really good things. And so we're excited. We think that it's going to be useful. This is what we love doing. Our 7-year-old understands, or at least repeats, the term insulin resistance. So we come from, I come from a family of physicians. So like I said, my father's a nephrologist, my uncle's a critical care doctor, my brother's an internal medicine doctor, and so we're really, really excited about what we're getting ready to do. So one of the things we'll do with this initial podcast is maybe kind of touch on briefly some of the things we want to talk about. So maybe a lot of things that you hear, the public hears a lot about this term insulin resistance, and we hear different statistics, like maybe 50% of the population or 70% of the population by 2030 has insulin resistance, and insulin resistance can lead to diabetes. There's another stat that I read that 50% of everybody that gets diagnosed with type 2 diabetes already has coronary artery disease. And if you go to PubMed, which is like the world repository of all of the medical information in the world, and you type in insulin resistance and cardiovascular disease, you get about 10,000 entries. And there's really no ICD-10 code, meaning there's no way to bill for the term insulin resistance.
There is none.
There is none. So we have metabolic syndrome, but metabolic syndrome, you can not meet clinical criteria for metabolic syndrome and be on the spectrum for insulin resistance. So in layman's terms, Felice, tell the audience, what is insulin resistance?
Okay, so if you're a patient of mine listening to this, you're giggling right now, because you know it better than most clinicians, unfortunately. So let me start by saying it's a spectrum disorder. Okay, so insulin resistance is very much a spectrum disorder, sort of like we think of autism as you're on the spectrum somewhere. Maybe you're severe, maybe you're high functioning. It's the same thing. And the most severe end stage of insulin resistance is essentially diabetes. So what is insulin resistance? I love analogies. I'm filled with them. You're going to have to put up with them. So if I give you a cookie, all right, let's just say something high sugar, right? You eat the cookie, and that conveys to higher blood sugars. Okay, so higher sugars in your blood. Your body doesn't love that. It's always trying to keep your blood sugars in a certain range. And when it starts to go out of that range, it's got to get rid of these blood sugars, these sugars, and it wants to put them inside your cell, sort of like fuel inside of a car. If I have a car that's not running, the fuel has to go inside the car, not on the outside. So think of your bloodstream sort of as the outside. Okay, so the sugars rise, and in response to that, the pancreas, which is the organ responsible for secreting insulin, which is a hormone, secretes insulin. And insulin's job is essentially like a key. It opens the door or the channel for the sugars to go inside the cell, fuel inside the car. Okay? And so over time, for many reasons, and this is where insulin resistance can get very complicated. We can talk about genetics as a reason, lack of sleep as a reason, stressors as a reason, poor diet, processed food, higher sugars, carbs, etc. That key, which insulin acts as, stops working. It's not working as well. It kind of gets budged, and more sugar builds outside in the blood. And in response, more insulin has to be secreted, or sort of like shoving the sugar inside the cell. Well, insulin does something very well. It's anabolic. It builds fat. And so my patients understand it from that perspective, because they come and they say, I'm struggling with weight. I can't get it off. What's going on? And the weight they're talking about is fat, not muscle, not bone, fat. And so the name of the game is, to reverse insulin resistance, you have to do all the things to keep insulin levels low in the bloodstream. And that's multifaceted. It goes beyond just diet.
So, talk a little bit about, so what you're saying is that as people enter into their 30s and 40s and they start to gain weight, a lot of the times, if it's not the main contributing factor, it is a factor, and that factor is insulin resistance.
Yes.
So explain in layman's terms, why is it that insulin resistance leads to weight gain, and why is it not only important that when you make your body more insulin sensitive, you'll lose weight, but also improve your overall metabolic health? Oh,
absolutely. I mean, and this could get really deep. I mean, down into the weeds of the biochemistry, which I don't think we want to do right at this moment. But yeah, absolutely. I mean, it affects multitude of things. In particular, we kind of think of the most common chronic diseases like heart disease, strokes, cancers, diabetes. These are all, there is an underlying factor and contributor by insulin resistance. I can't say 100%, but definitely there, you know, outside of some genetic factors as well. And so ultimately, it's really important that we kind of teach our patients how to diet, how to exercise, how to do it properly so that we can keep these insulin levels low. I don't know if that answered your question. I think you wanted to get into biochemistry. We should probably do that on another episode.
No, absolutely. I think our next episode, we'll do a little bit more of we'll go over insulin resistance in a thorough way. And I think that the take-home point, number one, is that if you are struggling to lose weight, as an adult, a major contributor to that struggle is going to be insulin resistance, number one. But the other thing I think that you're saying is that insulin resistance can really affect a multitude of different organ systems in your body. And so one of our goals with the way that we practice medicine is to actually target insulin resistance, measure insulin resistance, target it, and then find it, and then prevent it, and make your body more insulin sensitive.
Right.
And so what we're going to do is, that's probably going to be the focus of our next episode, is really kind of doing a deep dive with regard to insulin resistance. But just as a general, with regard to the podcast, we really, really want to kind of go over a whole multitude of different things. The other thing we forgot to mention is we have experts in the aesthetics field. So that's, we have a nurse practitioner that we really trust with regard to that.
There'll be some fun podcasts coming up.
We have a lot of exciting things that we're getting ready to do. So we hope that you'll tune in. We
hope you enjoyed our inaugural podcast.
We're really, really excited. But just to end, what are some practical things that patients can do just real quick to make their bodies more insulin sensitive? If you could tell them 4 things, what are some things they can do?
One would be weight training.
Okay.
Focus on that. 2 would be lower the recruitment of insulin, which would be lower sugars, lower carbs, and that's very blanket statement right there.
Got it.
3, stress. Making sure you have outlets and strategies for stress, and 4 would be sleep.
Roger
Making
that.
sure you're getting good sleep.
To be continued, guys. Thanks for tuning in, and we'll see you next time from the Preventus podcast.
Thank you.